This video is about the shortening of muscles and fascia. Is there even such a thing as shortening? If they exist, what do they do? Are they dangerous? How can we fix it? We'll address all of that thoroughly. Among the people who have encountered this term, there's a sense of uncertainty. Because they hear this, they hear that. We will clear up all of that today so you know for sure what it's about, what it does to you, and how you can free yourself from it. What we need to address right from the start is the question, do muscle and fascia shortenings even exist? And I'm always a very pragmatic type of person, so I take someone who isn't quite young anymore, maybe anyone starting from the age of 30 upwards, and while they are comfortably lying on their stomach, I attempt to gently bring their heel all the way to touch their buttocks. Very few people can do this, it'll stop somewhere in between. I'll show you here. Somewhere along the way, toward the buttocks, usually here at an angle of about 90 degrees, you'll notice it doesn't go any further. Now, of course, one could debate about why it's not going any further. I'll simply say that something here at the front is just a bit too short. That's why it doesn't progress any further. It's evident that no one is going to come along with a cleaver and chop off a piece of muscle or fascia or even cut away tendons. And those statements from the people who claim that, yes, it's scientifically quite clear, muscles cannot actually shorten. Hey, it's not a matter of opinions, it's really about why the heel doesn't reach the butt anymore like it used to. Because that's one of the reasons why the knee tends to wear out. We just call that shortening. If you want, just go ahead and put it in quotes. We already know what it's about. The muscle has too much tension and therefore doesn't yield. The fascia is matted and therefore doesn't yield. The joint capsule also plays a role. Whatever the reason, we call it shortened because the range of motion is diminished. And when you perform this test in the prone position, with the heel moving towards the buttocks on several different people, you'll begin to notice that for some individuals, it's quite strong. The resistance that suddenly comes into play, where the flexibility becomes less and less and then disappears altogether. And for others, it's a little softer. It's more like a zone where it progressively gets more difficult. So it all depends entirely on how the fascia and muscles are trained. But importantly, it keeps getting shorter. And now we want to answer the most important question. Why do we even shorten in the first place? Why does the tension keep increasing while flexibility keeps decreasing? Look, our entire body has a lot of joints. Counting even the smallest ones, there are over 100. And each of these joints has a certain predetermined range of motion. Let's go to the hip joint to demonstrate it using the hip joint as an example. But what we're showing now applies to all joints in your body. The hip joint is a joint that has a restricted movement because the head is in the socket, but it also has a ligament that prevents certain movements. But there are specific ranges of motion that are meant to be there. And when I do it like that, you immediately think, oh, but I can't do that. Now the big question is, why can't you do it anymore? You once could, because when you were just born, when you were a little baby, you were so flexible that you could be moved anywhere. You were able to put your large foot tendons into your mouth and so on and so forth. You know the saying, use it or lose it. It truly applies to strength, overall body stability, and so much more. That applies to flexibility too. Use your range of motion or lose it. And now comes the magic word in quotes into play. You see, if you don't move your joints and muscles as much, all the involved structures will naturally start to gradually adapt to the ongoing changes occurring, to not using it. And we already described getting used to it earlier. The tension of the muscles adapts to the corresponding angles. The fascia adapts as well. And of course, the joint capsule does too. And everything in the body gradually learns for itself. Oh, we no longer need this angle. Perhaps still a bit of this angle, so moving in from this point onward becomes increasingly difficult. And you can apply that to any joint, to the elbow joint, full flexion, full extension. Keep your elbow in a fixed and stable position for 1, 2, maybe even 3 days, or possibly for as long as a week. People who have had a cast know this. Every movement becomes difficult afterward. It's essentially the same thing, just with a somewhat different level of intensity. This means that at every joint in the body, this type of adaptation does not occur. And now it gets tricky because our biology is designed in such a way that we are supposed to use the angles built into our structure. Anything else really wouldn't make any sense at all. So what is integrated into the anatomy, it simply must be used as intended. Because if it is not used, we end up experiencing these shortening effects, and simultaneously, these shortenings cause an increase in the stress on the joints. Why? The moment a movement is supposed to happen, the agonists, the muscles responsible for the movement, become shorter, and the muscles at the back need to give way. However, in the antagonistic area, they can give no more. Then the joint is more stressed. Every joint needs a certain load because the joint needs to be guided. So, the yielding muscle always has to counteract a bit. This is physiological and built into us by biology. But when the fascial tension increases, which cannot be controlled by the brain, then there is wear and tear here, like a handbrake being applied. This is a splendid example you can really use to grasp that concept. Imagine you have an engine with 100 horsepower and you apply the handbrake. Then, part of those 100 horsepower will get stuck in the joint, meaning it will get stuck in the wheel, where the brake pads are overheating. To exaggerate the same situation, the energy that remains stuck because the muscle providing the yield isn't sufficiently flexible, that's the wear and tear we end up suffering from. And it increasingly becomes larger and more prominent the less the yielding muscle is willing and capable to give in. The less flexible it becomes, the worse the whole situation gets. And understanding this, following the processes that are happening in your body, most people don't know this. That's exactly why it's so important to share and communicate this valuable knowledge with everyone. Share this video and help us in the important task of spreading awareness. Because people simply need to have a clear understanding of what exactly is happening within their bodies. And as if what's already happening in your body without you knowing wasn't enough, there's one more thing added, which is just as bad, if not worse. You need to know that the cartilage in your joint, which practically covers the surfaces where the joint surfaces touch, we're talking about your cartilage. The cartilage in your joints needs to be nourished in the same way as all the other tissues in your body. The cartilage, however, is not supplied with blood, only very, very deep inside, not at all in the upper layers. There, it's white instead of red, which is a clear sign. It gets nourishment by being pressed, much like a sponge. Then the waste products go out. And then, when it is released, it absorbs the fluid in the joint again, with the synovial fluid, where all the proteins are contained, from which it gets its nutrients. That's how the cartilage is nourished. It means it must be compressed and released repeatedly. That happens automatically with movement. But now imagine if the hip joint, as is the case with many people with today's lifestyle, only moves like this and a little like that when walking, barely moves outward into the split position, and barely inward, unless I'm actively playing football. Then there's simply just very little movement happening, which is related to, or rather results in the fact, that the contact surfaces of the cartilage, if this here is the socket, and now the joint head is positioned here, typically range from here to here. Everything gets pressed and then released once. If it only moves from this point to here, then the edges. In this example, the areas of the hand are no longer compressed and released at all. That means there's a kind of famine situation occurring for the cartilage. In the middle part of the joint, where it is touched frequently, it wears out due to the excessive pressure being applied, as I mentioned earlier on. In other areas where it's no longer touched, in that area, it deteriorates because it's essentially starving. This means the cartilage really has no chance if we don't use the entire range of motion our joints are capable of offering. To sum it up once again, not utilizing the joint angles leads to the shortening of the surrounding structures, and consequently, this increases the pressure on the surfaces that come into contact with one another, because the remaining angle is still being used here. And the second effect is that certain cartilage areas are no longer nourished because they are no longer being compressed and relieved. And now, the issue of pain comes into play. You might already know from other videos that this should be considered on its own, separate from arthritis or other damage that may have occurred. The pain, which is simultaneously and naturally present, tends to be there well before any significant damage actually begins to occur or even become evident to the individual. It was there before because it wants to avoid damage, actually. I hope if you've followed me this far, it makes sense to you when I ask you again to share this knowledge with others, so that everyone is informed and knows what's going on in their body. And now it's about what you need to do to make sure all the angles are used. That's where our expertise truly lies. It's fundamentally what our pain therapy covers. Restoring the angles once again, where it became too short, bringing back the necessary length. If you haven't subscribed to our channel yet, please do it now, so you'll be able to watch many other interesting videos in the future. Bye. See you next time.